Hello everyone, my name is Dr. Adam Kossin and I'm a chiropractor at Elite Sport and Spine. Today I'm going to be presenting some information for you on how you can conquer back pain. This was a presentation we were supposed to be doing at the Greendale Public Library this past Wednesday, but with everything going on, unfortunately we had to cancel that. But we figured we should present this information anyways because it is important and it's not also about coronavirus right now. So you guys might be able to learn something that's not related to that. We're going to go ahead and get started. We have two locations. We have a Brookfield location, which we are at this morning, and I am located at our Greenfield clinic. We have two chiropractors, myself and Dr. Zach Shields. We have a physical therapist, we have a massage therapist, and a clinical nutritionist. So we can kind of tackle a lot of different aspects of patient care. Our practice is focused around three different pillars. We have the chiropractic adjustment or spinal manipulation, which chiropractors are known for. There's the manual therapy component, or working on muscles and joints and tendons and ligaments and stuff like that. And then we like to do a lot of exercise. We think it's important to get appropriate movement into your body, and then we can build up some strength. So with the combination of these three things, we feel like we do a pretty darn good job at tackling back pain in general. And this can be used for many other soft tissue injuries. If at any point, if you guys have any questions, feel free to just put a comment below during the video and we'll get to them at the end. I think a great place to start with this is we kind of need to define what pain is. And this is a definition that I heard from Barbell Medicine, and they kind of define it as it's an experience that drives a behavioral change or a change in action in order to protect us from something that our body perceives as a threat. And they kind of compare this to hunger, and hunger being the body's protective mechanism against starvation, because there are so many different factors that go into an individual that is hungry or feeling hungry. They could be very stressed, and a lot of times when people are stressed, they tend to eat more. Same thing with pain. A lot of times when people are stressed, they tend to experience more pain. If they're in a social setting, a lot of times people will tend to eat more because of it's just being around and people are doing it. There's that other comparison too, where a lot of times if people are super busy either with their job or with life in general, they may not even notice that their back hurts, or they just kind of go on and then they think like, yeah, I didn't even have back pain that day because I was so busy. So there's so many different factors, whether it's physiological, social, environmental, or psychological factors that we as practitioners, we have to kind of consider versus it making just one pinpoint thing. So a few stats. I know this graph here is a little bit difficult to read probably from your screen, but I'll summarize it for you. It's one of the most common disabilities worldwide that is reported, and it's estimated that $50 billion, Americans spend $50 billion when dealing with back pain per year. And that could be doctor's visits, that could be surgeries, that could be imaging, anything like that could be kind of lumped into that $50 billion. So that's a ton of money. This graph on the left here shows years lived with disorders. The top one there in orange is neuropsychiatric disorders. So that would be depression, anxiety, stuff like that. The second one is musculoskeletal disorders. So you can see that these two are way further than any, or have a higher number than any other of the other ones. The third one is other non-communicable diseases. But I'll explain later that these top two are pretty closely related, and a lot of times individuals dealing with neuropsychiatric disorders also are dealing with musculoskeletal disorders. So these are things that we have to kind of closely monitor and make sure that we're addressing as well. A few more stats about back pain. It is the second most common reason to visit a doctor, other than upper respiratory infection. That might be a little bit skewed now with everything going on, but it's a lot of times people go to a medical doctor because they're dealing with back pain. It's estimated that 80% of the population will have a bout of back pain at some point in their life, and if you have a bout of back pain, that is the number one precursor for having, or predictor for having, another round of back pain. So most cases of back pain are diagnosed as a non-specific low back pain or back pain. And this is not to minimize the experience that the individual is dealing with, but it's more so to encourage them and tell them that this is not usually of a major serious underlying condition, and it's something that can be managed. So, being chiropractors, we hear a lot of these quotes in our office on a pretty regular basis. The first one is that I have a bad back, or my dad or mom had a bad back, so I have one as well. And that doesn't necessarily need to be the case. There's this belief that degeneration or spinal wear and tear per se could be causing your back pain, and we'll get into, I'll present another paper and a study for you later of why degeneration is not a very good predictor of an individual having back pain. There's this widespread belief that surgery is the only option for you, and it's very highly recommended to try conservative measures prior to, and that could be chiropractic care, that could be physical therapy, that could be exercise, that could be cognitive therapy. Anything of those is a trial of that is recommended prior to having surgery. There's this belief, especially as chiropractors, we've kind of talked in our history of that we kind of preach about having good posture, and having bad posture might correlate with having an individual dealing with back pain. And there's not really a whole lot of evidence to support that one specific posture correlates directly with an individual having back pain or might be a predictor of an individual having back pain. So rather than focusing on one specific posture, we always like to just encourage people to move as much as they can throughout the day. And I like to paint this analogy for somebody. If you were to take somebody and have them sit in their ideal posture for 8 hours and they couldn't move, versus somebody who would, sit in less than ideal posture, a kind of slouched posture, but they also couldn't move. Both of these individuals most likely are probably going to have pain after 8 hours. It just means that they just might hurt in different spots. So again, it's not really a great indication of whether or not an individual is going to cause, or whether or not posture is going to cause back pain. And this rest is the best cure kind of goes along with anybody dealing with musculoskeletal complaints. A lot of times if something hurts, they'll just I just took a couple months off and then I hopped back into it. And a lot of times it just kind of hurts as soon as you hop back into it. And I think this is a really important thing to know, that specifically with back pain, rest is probably the last thing you should try to do. Now that doesn't mean we need to just jump into normal activities and just power through the pain. No, we have to kind of dose it appropriately and move appropriately, but I don't think rest is the option here. And then this belief that pain means that you're doing damage. Pain, again, is not a very good predictor of tissue damage occurring. There are certain situations, for example, if you break your arm or if you tear a muscle, that stuff hurts, and there's a pretty good indication that it's coming from that specific injury. But in back pain in general, the fact that there's an individual tissue or an individual joint that could be causing pain probably is not a very good indication. Moving on. This is a little graphic that I created that shows all of the different factors that could be contributing to an individual having back pain. There's so many different characteristics or factors that we have to consider versus just the mechanical one, or how your body moves. We have to kind of dive into a little bit of the psychological aspect of it, and we're not psychiatrists or anything like that, but it would give us a good indication if we need to kind of co-manage this with another individual. We're not going to touch on all of these, but this is a good graphic to show you that there are more than just joints and muscles and ligaments and stuff that could be contributing to your back pain. So the first one, what does this tell us? It tells us that there's more to consider. We have to go into kind of the psychological aspect, the physiological aspect. What is your social setting like? What is your socioeconomic status? And I know right now in the world today, there's a lot of people that are super stressed out about work, what it's going to look like when all of this stuff ends. So stress levels are very high right now. That could also be contributing to what is going on. And I think it's important to note that back pain or low back pain doesn't usually have one specific underlying cause. So I don't want to minimize what you're dealing with, but we have to kind of look at it in a more of a broad picture. So the first one that we want to talk about is this idea of lack of movement. And right now, pretty much almost, I think almost all the gyms are closed, if not like 90% of them. So there's a lot of individuals who went from being pretty active to being now relatively sedentary. And we want to encourage individuals to try to be as active as you can in your home. Like try to get clever with different workouts, squatting and deadlifting stuff that you might not squat or deadlift. But we got to try to stay active in this time where we're kind of forced to hunker down into our homes. But this lack of movement is usually due to an individual who's not prepared for the workload that they're exposed to. And the workload necessarily doesn't have to mean weightlifting, for example. It could be you work a heavy labor job and you're forced to carry stuff. If you're a mother and you have kids running at you that are expecting to be picked up, are we able to carry out that task on a relatively repeatable basis? And if we're not, that kind of can increase our chances of potentially having an injury. So again, we talked about this idea of resting, but if you're dealing with back pain out there right now, I want to encourage you to try to not be sedentary with it. Get off your couch, get off your seat, and try to become active. And that could be, going for short little walks and around your house, around your block. I know we're not really encouraged to go outside right now, but let's try to be as active as you can, and that'll help with dealing with your back pain. In our office, we like to teach, and we think it's really important to teach these 3 movement patterns: the ability to squat, the ability to hip hinge, and the ability to lunge. These 3 patterns allow you to put yourself in a good position to carry out everyday tasks. I mean, every time you sit down you sit down to a chair, or you sit down to use the toilet, or performing a squat, whenever you're picking up a laundry basket or you're picking up your child, we could do it in a way that we're using a hip hinge, which allows us to kind of use our hip muscles and our low back, or our lower extremity muscles, our legs, to lift the child. And then lunging is a great way to get yourself down to the floor. If we're down to pick something up, or we're cleaning something near a baseboard, we can use a lunge to do that. So making sure that we're teaching this appropriately to all of our patients, but then also trying to encourage them to build strength in these different movements. This phrase down in the bottom left corner, "motion is lotion," I think is a good takeaway for this. We really try to encourage as much movement as we can. And again, it's important for us as clinicians to make sure that we're dosing this appropriately for the individual, and we're not exposing them to something that is beyond what they're capable of. So everybody has a different level of fitness, so we got to make sure that we're kind of plugging you into this at the appropriate time. So some of these mechanical factors that we see in our office: a muscle strain. Usually a muscle strain occurs when we've exposed our muscles to a load that is beyond what it's capable of lifting, or capable of its capacity. Now that could be either running too fast or too long. It could be lifting something beyond what we're able to lift, and now we have a little tear in the muscle. With the soft tissue work that we do, we actually do a pretty good job of managing these, and a lot of times these heal pretty darn fast. We just got to do some soft tissue work, get some good movement in there, and we can clear this up pretty quickly. These next 2 are going to be good talking points going forward. There's a lot of individuals that come to us saying that they have disc herniations at this level and this level. In the low back, it's usually between L5 and S1, which are different bones in the bottom of your spine. And you could call a disc herniation a disc bulge. There was a study in 2002 that looked at the clinical factors of low back pain, and then they also took imaging of these same factors, and they tried to correlate the clinical finding with the image finding. And it was determined that only 2 to 5% of these had a direct correlation with what the patient was dealing with and a disc herniation on the image. So just because you were given the diagnosis of a disc herniation doesn't necessarily mean that disc herniation is causing your back pain. And I would argue that it probably is not causing your back pain. We'll get into more details of what would be signs of a significant disc herniation, but we'll kind of leave it at there. Spinal degeneration, I think, is a very normal process of aging. As we get older, our body kind of goes through, I don't like to use the word wear and tear, but it goes through changes to become accustomed and adapt to what we expose it to. So I think spinal degeneration is a pretty common thing. So if you went to a doctor or you had images that were done and they diagnosed you with spinal degeneration at various levels, I don't want you to hang on to that. I want you to just accept, yep, I have spinal degeneration, but that doesn't mean you can't get better. We can't, there's nothing out there that can reverse spinal degeneration. So if that's been told to you, that's not true, but you can live life with it. I mean, you just kind of build yourself around it and become stronger, and it doesn't really affect you. The last one, joint dysfunction, that's kind of what us as chiropractors are known of correcting. We do a pretty good job at identifying which joints could use some better motion, and then whether we're using mobilization or manipulation or adjustment, we can help to improve that range of motion pretty quickly. Specifically the disc herniations and the spinal degenerations, I don't want you to identify with these. We kind of talked about that, but I don't want you to hang on to this label that I have a disc herniation or I have spinal degeneration, because it can become quite a barrier mentally to try to break through in order to get better. We always want to encourage people to just kind of look at their body as a whole versus like regional and very specific problems. Yeah, you could be dealing with back pain, but again, statistically, it's probably not due to one of these things, and it's probably a combination of multiple different things. So I don't want you to have this woe is me, like this is, you have to feel bad for me type of ideology, but versus let's just try to attack this thing with movement and building some strength and stuff like that, and we can really improve on our back pain. So I would assume on your screen this probably does not show up very well, but I'll kind of break it down for you. This is a study that was done in 2015, and they took over 3,000 individuals that had no back pain. They had no symptoms, they'd never had a history of back pain, nothing like that. And they have people from the age of 20 all the way up to 80 plus. And they just took a CT or an MRI, a CT scan or a MRI of their back. And what they found was at the age of 50, 80% of these individuals had some form of disc degeneration. There was 60% of these individuals, again at the age of 50, had a disc bulge. When you get up to 80 years old, 96% of those individuals had signs of a disc degeneration. 84% of those individuals had signs of disc bulges. So again, there's these individuals that have no symptoms. They just shot pictures of them, and they reported that a lot of these people show signs of disc degeneration, spinal degeneration, but there's no pain. They don't deal with any of it. They don't even know it was there. And I think if you were to take the average individual and they don't have back pain, or if you shot an image of their shoulder or an image of their neck and they don't have neck pain, they're probably going to have some finding on there. But again, it doesn't necessarily directly correlate with an individual dealing with pain. So again, I don't want to minimize the experience of what you're dealing with, but I also don't want you to hang on to these labels, because these stats and this data can show that it usually doesn't correlate with the individual directly dealing with pain. So some of the other factors that we have to consider. The reason why we have a clinical nutritionist in our office is because she's very good at managing individuals' weight. This is not our area of expertise. We can kind of encourage individuals, like maybe we need to start to go down this path. We have other resources in the area that we could refer individuals to if they are serious about wanting to lose weight. But there's a direct correlation with body mass index, or your BMI level, and an individual dealing with back pain. And if you have a BMI level over 35, you are 1.6 times more likely to have back pain, and chronic back pain specifically. So it's something that we want to encourage. Again, with diet, not a thing that we usually go a ton into detail with, but we have resources for you. But we want to try to encourage all of our patients to try to limit the highly processed and highly inflammatory foods. So your fast foods and stuff like that. Highly processed foods can encourage just general inflammation in the body. And if you are dealing with back pain, it can kind of increase the levels of pain that you're dealing with. We also want to kind of dive into what are your physical activity levels? Are we meeting the physical activity guidelines for America? And if you actually just Google the physical activity guidelines for America, you can see what they are for your age group. It depends on where you fall in that category. But are we doing enough work and exercise throughout the week, and what type of exercise. Are we doing only cardio and we're never exposing ourselves to strength training? Are we doing some strength training and no cardio? Kind of where did we fall? That would be me. I do mainly strength training and very little cardio, but kind of where do you fall into that? And are we meeting the recommendations? Because if we're not, again, we kind of want to start there, try to increase some of our physical activity guidelines, and then hopefully we can continue to build on that. Sleeping. Sleeping is such an important aspect of anybody dealing with any sort of musculoskeletal complaint, because sleeping is really the only time that our body recovers. If we're not getting adequate amount of sleep, we're really limiting our ability for our body to make change and adapt to that change. And there's a direct correlation with sleeping less than 6 hours. You are basically 2 times more likely to have chronic back pain. So if we're dealing with chronic back pain or pain that's been 3 months or longer, let's take a look at what is our sleep schedule like. Are we sleeping 4 hours a day? Are we sleeping 20 hours a day? Like, where do we fall in that sleep scale? And is that an aspect that we could potentially improve on? One of the other lifestyle factors is smoking, and again, something that we kind of sometimes talk with our patients. We try to encourage them to not be smokers, but again, this is not really our area of expertise. But there is a direct correlation with being a past or current smoker and an individual dealing with back pain. So this is something that, again, that we want to address and try to encourage, because smoking just increases general inflammation in the body. And again, if we're dealing with back pain, that's a possibility of one of the factors causing it. The psychological factors. Again, I am not a psychologist. This is not my area of expertise, but this is something called a yellow flag. There are red flags, which would mean like immediate referral to an emergency room, and then yellow flags. Yellow flags would be something that we would need to co-manage with an individual, like a psychologist. So the first one would be an individual dealing with depression, an individual dealing with anxiety, because there's direct correlations with both depression and anxiety and dealing with chronic low back pain. So again, a lot of times we would co-manage this with an individual, because if we're not addressing that and we're just addressing the musculoskeletal complaints, there's a good probability that we're going to be missing the boat a little bit, and they're not ultimately going to get better. So we got to make sure that us as practitioners, we're being aware of these things. We're asking the right questions to make sure that we are being exposed to this. Catastrophizing is a long fancy word to basically mean that individuals are blowing this out of proportion, or they're making this bout of back pain or this symptoms to be the worst thing that they've ever had. And again, that can become quite a mental barrier to break through. So we want to try to limit those kind of thoughts of creeping into our brain, and instead trying to kind of lessen those so that we can actually push through those barriers. One of the things that we hear a lot of, or that we see a lot of, is this fear of movement. And with back pain, I think the most common one is individuals kind of bending forward, or spinal flexion will directly correlate with an individual having a back injury or a disc injury or something along those lines. And we, as chiropractors, we don't want to encourage individuals to fear specific movements. Our body's designed to move in all of these different ways. But if we're, again, never exposing ourselves to that specific movement, that's where the injury potentially lies. So if we never bend forward with some sort of increasing load on a regular basis, and we try to lift something that's 200 pounds, that's a recipe for a potential injury. So we want to encourage people that movement is medicine, and we really need to do it a lot in the right direction and the right style. But we don't want individuals to have this barrier that movement is directly going to cause damage. Specific movement is going to cause damage, because it can just become a major problem when we're trying to prescribe you exercises to do. And the last one is a lack of social support. If you're kind of going at this on your own, it can be kind of overwhelming, especially if you've been dealing with it for months at a time. Surround yourself with people that either have gone through it and they've succeeded, or they've had good experiences when managing back pain, and ask them what they did. See if they have good resources for you. See if they have a chiropractor or a physical therapist or somebody that they went to that was a great experience, and they helped them get better. And surround yourself with them. Ask family members and be like, hey, I've been dealing with this, and it's been kind of a bother. I need some support right now, and I would really encourage that, or I would really like that. So surround yourself with people that are going to be supportive of you and encourage that, yeah, you're going to get through this. It might take some time and some hard work, but that's an important aspect of this as well. A little bit of back pain research. We're not going to go into this too much. I don't want to bore you with this. But there was a study of college males and females, so they did about 1,000, or they looked at 1,000 individuals, and there's a direct correlation with feeling sad, exhausted, and overwhelmed, which for me basically was my college in a nutshell, and then directly associated with low back pain. So again, we have to kind of look at both of those at the exact same time. Is there a potential of one of those psychological yellow flags in an individual dealing with back pain? The next one, there's this bottom quote here is what I want you to focus on here. This looked at a individual. This was a 5-year follow-up study that was done, I believe, in 2005, and they had individuals that had surgery done at the beginning of that 5 year, and then they followed up within 5 years later. And then they had another group that was doing cognitive intervention and exercise. So they had two different groups. One had surgery, one had cognitive intervention and exercise. And they did the initial follow-up, and then they did another follow-up in 5 years. And what they found was that individuals who had the surgery, I think it was 25% of them within that 5 year span had a second surgery or another fusion. And then at the end, the outcomes were pretty much exactly the same. So if you could avoid having surgery for a non-specific low back pain, I think it would be highly encouraged. And again, there are so many modalities and things out there that you can try before going under the knife and potentially having surgery that might not even have improved what you were dealing with. And what I want to say about this is I would imagine a lot of you individuals out there has had somebody who has had back pain surgery, and maybe they're still dealing with back pain. So if you think about it, they've potentially removed the mechanical stimulus of the back pain by fusing it or removing the disc or cutting off the back of the bone, and they're still dealing with back pain. Then there has to be more than just the mechanical aspect going on. So potentially surgery might not be the option. There are certain situations where that is the only option, and we'll get into that later. So how do we treat this in our office? I created this flow chart, and I would be lying if I said that every time it goes through this flow chart, but this is kind of a general guideline. We perform an exam. We have to kind of figure out what's going on. We have to ask a lot of questions, make sure we're getting enough detail in what you're dealing with. We have to identify a lot of these contributing factors, some of the stuff that we've gone over. We need to then co-manage. Again, we have a physical therapist that can do various aspects of care that we can, like dry needling. We have a clinical nutritionist that can go at the dietary and the weight loss and all that kind of stuff. So we have referrals for psychologists in the area and stuff like that. So we need to co-manage this if necessary. We like to improve the joint mechanics and some of the soft tissue qualities. So that could be doing Graston technique, doing some self-myofascial release, doing some adjusting, doing some mobilizations. But if we can improve the joint and soft tissue work, it primes our body and sets us up to find a good entry point of movement. Again, everybody has different exposure to exercise. So if you've never squatted in your life, we're not going to throw 135 pounds on your back and make you do barbell back squats, because that, I think, is going to be a recipe for disaster. So let's dose it appropriately and kind of ease into these different movements so that we can get better at it, and hopefully we can find this appreciation for it and continue to build on it. And then we really try to encourage self-efficacy. It's an important aspect of our care, and we think that if we can teach you a bunch of stuff on how to manage it on your own, that if you do have a flare-up, which statistically we talked about having previous back pain is the #1 predictor of having another episode of back pain. If we can teach you enough stuff and you can manage it on your own, I think that we've done our job really well then. So we try to encourage individuals to try to manage it on their own if they do have another flare-up. So that's kind of the general guidelines. Again, I'd be lying if I said it goes this way every single time, but we try to follow this plan roughly. All right, we want to set goals with you. We don't want to drag you through this process of rehabbing low back pain, but we want to be there as a guide for you. And a really important way to do that is setting up goals that follow this acronym, this SMART acronym. So making sure the goal is specific, it's measurable, it's attainable, it's realistic, and it's timely. If we've never run more than a 5K in our life, and in a week we're going to run a marathon, and that's the goal that we're trying to hit, that might not be realistic or attainable. So making sure that we are setting up goals that we can reach every single time. And if we don't, what can happen is we can then start to set ourselves up for failure, and it can kind of perpetuate down this road of I'm never going to get better because I'm not reaching any of these goals. So specifically with low back pain, it could be something as simple as I want to be able to pick up a laundry basket that's full of clothes without having back pain. I mean, that's something that we can set a goal for, and we can try to build up to that and try to make sure that that's something that we can hit, and we can set a date for it and all of these things. So this is a really important aspect, and we want to work with you on how to do this. I think it's important to know that this graphic on the right kind of shows what success usually looks like. It's not a linear trajectory here. It's got a lot of ups and downs and regressions and stuff like that. And I think that's an important aspect of anybody dealing with rehab. There's going to be days that it sucks. You're going to have days where you wake up and your back hurts. Let's be honest. It's important to know that we need to do something on those bad days, and even on good days, we need to do something. We have to be conscious of what we're doing so that we're not overdoing things, but there's going to be good days and bad days. So it's okay to have this expectation because it is a reality. Continuing with this, we need to develop a proper mindset. I encourage all of my patients to, rather than focus on what they can't do anymore, because again, that can kind of set our brain up and our mind up for failure. I want you to focus on what you can do and what you're able to do. It sets your mind up for failure, or for success rather than the failure. And again, we may have to scale this. If you're dealing with back pain and you like to deadlift or something, and every time you hit like 315 pounds or 225 pounds and your back starts to hurt, don't focus so much on the weight. Focus on the fact that we're still able to deadlift at 135 pounds, or I can still squat at 135 pounds, or I can pick up a laundry basket that's half full. Focus more on that stuff versus, well, I just can't do this. And my back pain is getting in the way. Again, it can become quite a mental barrier to try to break through. And if we can shift our mindset, we can kind of focus on the can instead of the can't. And then we need to start to train our body for the workload that we're exposed to. And again, we talked about the physical activity guidelines for Americans. I think this is a really great great place to start. Are we meeting some of these guidelines? And if we're not, where can we try to improve? I know right now we're kind of at a disadvantage because we might not be able to get the strength training in that we need because of a lot of the gyms closing. But if we can still try to meet the cardio goals for the time being, I think that's a great place to start. A good question that we'd like to answer is, when should you see somebody about this? Or when is back pain serious enough that you should either see a chiropractor, a medical doctor, or a physical therapist? I'm going to skip to the middle and talk about the medical emergencies. If you're noticing that you wake up and you have the inability to control your bladder or your bowels, please do not go to the chiropractor's office. Please have somebody drive you to the ER. That is a medical emergency. If, for example, specifically with low back pain, if you have lost the ability to use your lower legs, or your legs in general, that would be another medical emergency. That means there's something more serious going on than us as chiropractors or a physical therapist could manage. So please go to the ER and get the appropriate care. But other than that, there's not a whole lot of reasons why an individual dealing with back pain should be going to see the ER, especially right now. With everything going on, please try to limit overflow into the hospital. So if you're dealing with medical emergencies, with these two, then that's a good time to go to the ER. But other than that, I think a lot of times conservative care can help manage it. So when should you come to either a chiropractor like myself or a physical therapist or somebody along those lines? If you're concerned about it, if you have questions along the lines of your back pain, I think that's a great place a great time to go see somebody. If it's starting to limit what you want to be able to do, again, we try to focus more on goals versus pain levels because pain is very subjective. But if you're not meeting the goals that you want, I think that's a really good place to start. Or if you have fear about it, again, we have talked a little bit about the idea that fearing certain movements or having fear of back pain can really become a mental barrier. So if you're dealing with one of these things, I think that's a really good place a really good time to go and talk with an individual about it and seek some guidance. And make sure that this individual is going to be able to guide you in the right direction. If you meet with somebody and what they're telling you it just doesn't sit well with you, then go get a second opinion. That's your right. You can do that stuff. So find somebody that's going to guide you in the right direction. Who is in the area to help you? In my neck of the woods or over in Greenfield, the Greendale area, there's a great gym called Rosenfitter Ultra Fitness and Performance. They have 3 coaches over there that really have a great understanding of teaching how to squat, teaching how to hip hinge, teaching you how to deadlift and lunge and do all of these basic everyday movements that we should know how to do. But I think that where they specialize most is they know how to dose it appropriately to you, the individual. They're not just going to throw you into a situation that you're not comfortable in. They want to make sure that you're comfortable and you learn how to do the movement correctly. And they're really, really good at it. They teach this stuff really well. It's a very happy and friendly environment. Unfortunately, they're closed right now, like most gyms. But if you're looking for a place to build some strength in a really, really great environment, Rosencutter Ultra Fitness and Performance is a great place to do that. Who else is in the area? Obviously, myself or Dr. Zach Shields in Brookfield, we would love to be a resource for you. If you're dealing with back pain, we have some great resources in the area. Whether it's a physical therapist near where you live, I know a handful of physical therapists over in the Franklin area. If you're looking for a physical therapist here, we have one. But we can help guide you through this process. We can give you the necessary chiropractic care and dose appropriate exercise for you to build some confidence and some strength so that you can get through this stuff. And I think we're really good at setting patients up with the proper mindset and making sure that we're setting proper goals for them so that we can get over this thing. So I did want to, before I say thanks for listening, I did want to mention that right now our offices are both still open. Obviously, with this kind of being a very unknown time, we don't know if that's going to be the case. If there's some sort of martial law that comes out and it forces us to close down, then unfortunately we're going to have to do that. But as of right now, we are open, and we would encourage you to go to an individual if you haven't been exposed to anybody dealing with the coronavirus. If you are dealing with musculoskeletal complaints, please try to not go to the hospital for it. They have so much other stuff that they're dealing with right now, and we don't need to overflow that. So we both are open. We are also now beginning to roll out something called telehealth, which is an online appointment basically, where we can go through some movement assessments. We can teach you some different ways to mobilize joints and soft tissue on your own. And in this time of where technology is kind of dominating the world, we feel like it's a great way for us to kind of still treat you and help you out through these musculoskeletal complaints where we can't do a lot of the hands-on stuff if we were forced to close. So that's what I have for you today as this back pain presentation. I wanted to say thank you so much for watching and tuning into this. I hope this is our first time doing a live stream, so I hope it went okay. And most importantly, please stay safe. Please be healthy. If you have been dealing with any of these cough or sickness or anything like that, please try to limit your exposure to other individuals so that we can get through this pandemic, hopefully quicker rather than later. Any questions? No? Alrighty. Well, I hope you guys have a great day. Thanks for watching.